I am a general surgeon, and I do not take insurance of any form. I don't take Medicare. I don't take public aid. And currently my practice is better than it's ever been in my 25-year career. And what I'd like to describe for you is a little bit how I got here, why I got here, and how things are working out. First, I want to ask if anybody remembers what indemnity insurance is. Is there anybody in the crowd that ever saw that? There are a few. Yeah, when I started practice in the mid-1980s, and at that time, my payer profile was a third of my patients had insurance, and all of those insurances were what's called indemnity insurance, which means that whatever my fee was, it was paid 100% by the insurance company. Those policies don't exist anymore. Another third of my patient population had Medicare, and then the last third were either public aid or non-paying patients, and the public aid really in Chicago at that time amounted to the same thing. The surgery that I was doing covering the emergency room were for either patients that I would never receive payment for or they had Medicaid, and Illinois at that period of time, roughly 9 out of 10 bills that I sent to Illinois Medicaid were summarily rejected. But the way that they used to do it is they would say, we're suspending your bill for review, and the statute of limitations was 2 years, and they'd suspend the bill for review over 2 years, so it would just simply expire. But even back then, you know, I realized that it was kind of a precarious position that I was in, because 90% of my income came from a third of my patients. For example, one of the most common operations that I do now, and then even back then, is a hernia repair. And back then, my fee was $1,800 for a hernia repair. From my patients with indemnity insurance, I was paid the full fee for that. Now, I'll tell you, Medicare was never good, not even when it was first created or in the middle 1980s. And back then I was being paid about $600 to repair a hernia versus what my indemnity insurance was. Now, during my first 15 years of practice, that remained relatively stable. I was able to make a comfortable living, and I worked hard, and that was okay. And you know, all the time I kept my eye on what was going on with private insurance. That was around the time that a new entity had been created and was starting to get some foothold, and that was managed care and HMOs. And during my first 15 years in practice, I stayed as far away as I could from managed cares and HMOs. So I just kept my indemnity insurance patients and my Medicare patients, and I did the ER call and took the Medicaid and the non-payment patients. However, around 1999, I was becoming very concerned about the progression of how the managed care health insurance companies were taking over the insurance market. And I started to see the other insurance companies start to pay closer to what Medicare was. Everybody was starting to follow Medicare, and that started happening about 10 years ago. And from 2000 to about 2005, I was watching this, and I was thinking to myself, this isn't going to end well. You know, I can't take a 67% income decrease in my gross revenue and even keep my office open and pay for malpractice insurance and all the other expenses that we had. Now, so that was the point where I realized I had to do something different, and I had to free myself from the crushing blow that was coming from managed care and how it was taking over the practice of medicine in the community that I was in. Now, going back to the beginning of my practice, I took care of uninsured patients who were able to pay for their procedures. And it took me a long time to figure out how to do that properly, because my first crack at it really was very unsuccessful. What I would do if I had a patient that came to see me that didn't have any kind of insurance, and we had them back then, not as many as we do now, I would simply tell the patient, okay, this is what my fee is for your surgery. And for example, for a hernia surgery, I would say, my normal fee for this is $1,800. You're going to pay cash, so I'm going to charge you $800. I'll give you a $1,000 discount. And the patient would say, oh, that's great, I'll pay right now. And I'd say, well, wait just a second. There's a little bit more to this. For me to do the surgery, I have to take you to a surgical facility, and I have to have an anesthesiologist. And so what I did was I handed my patient the telephone numbers for the hospital facility and for anesthesia. I said, you know, I've given you a good discount for my service. You now have to talk to the hospital and talk to the anesthesiologist and work out a deal with them. And, you know, I wanted to stay out of that. I thought, you know, whatever a deal they can strike up is great. You know, if they can get it for free or they can get it for near nothing, that's fine with me. As long as my fee was paid, that was fine. Well, I did that for a lot of years, and the number of patients I was doing it for was pretty limited, though. You know, I wasn't becoming known as the one who could provide surgery for patients that didn't have insurance. And I started to think about why this wasn't really working and, you know, what I needed to do. And so I talked to a few of my patients after their surgery, and I just asked them a simple question: what did the hospital charge you? And when I found out what the hospital charged them, I was absolutely aghast. The hospital was charging $8,000 for the hernia operation. Then I would ask, well, what was the anesthesiologist charging? And they would tell me $2,000. So I was making $800 and doing the bulk of the work. The hospital was getting $8,000 and the anesthesiologist was getting $2,000. And so I knew why it wasn't working, but I still didn't know how to fix the situation until one afternoon in the doctor's lounge. I was sitting down having lunch with a plastic surgeon friend of mine, and I was lamenting about how terrible medicine is now and what insurance is doing to us all. And I've been trying to do this non-insurance work, and it's just not working, and this is a problem I had. And my buddy said, well, Kevin, you ought to follow our model. This is a plastic surgeon. And he said, what we do is we charge a package price. That is, when we tell the patient what the price is for a tummy tuck, it's an inclusive price. It includes the facility fee, and it includes an anesthesia fee and my fee. And so I asked him, well, what do you pay for an hour in the operating room? And it takes me half an hour to do a hernia repair. He goes, well, the facilities, most of the facilities in town here charge about $1,000. And my patients routinely had been charged $8,000 for this service when they went to the hospitals to try to negotiate the best price. Then I asked him, well, and what do you pay your anesthesia? And he said, oh, about $300 an hour. My anesthesiologist had gotten $2,000 for a half an hour. So I refactored everything. I came up with a package price, and I was able to put together a package price to make surgery really very affordable, in particular compared to what the prices patients were paying if they were going out and negotiating this themselves. And because of my conversation with my plastic surgeon friend, I had a basis for which to talk to the surgical facilities and talk to anesthesia. I also started educating myself on what these real costs were, you know, what hospitals were actually being reimbursed and what anesthesiologists were being paid. And I'll tell you, I had another little personal experience with that I was able to use that to a tremendous benefit to myself. My wife and I had our last child after she was over 40 years of age, and so with her insurance, they excluded her OB coverage. And she had had a previous C-section, and she needed a C-section. And so we were planning the date on when the C-section would be done. So I went to the hospital where I do all my work, and I'm one of the highest profile physicians at this particular hospital. And I went to the CEO and I said, you know, I want my wife to deliver here. She needs a C-section. She'll be in the hospital less than 48 hours, I'm sure. And I said, I want to pay cash for this. I want you to give me your best price. And he said, give me a couple minutes and I'll call you back. And he called me back and he said, well, the facility fee is going to be $35,000. And I go, oh. And I said, let me ask you a question. What does HPN pay you guys for a C-section and 2 days in the hospital? And he said, $2,500. And I said, okay, let me tell you what I want to do. I'm going to pay you $3,500 for that service. And he goes, okay. So anyway, everything in medicine is negotiable, and having knowledge is power, and understanding what fees are and what fees are not, you know, helps a tremendous amount. And it helped me in my practice by developing a package price to make these things really affordable for patients. Okay, well, the next part of this is actually building the practice. And I'll tell you that in my 25-year career, I've built a practice from the ground up 3 times. The very first time I did, which was coming right out of practice, out of training in 1986. I had completed a general surgery residency. I'd also had completed a fellowship in transplant. And my wife and I had 3 babies, and it was time to start making some money. Back then, it was the standard way of building a practice was by doctor networking. That is, you go to all the M&M conferences, which don't exist anymore. You go to the department meetings, which nobody goes to anymore. You go to hospital functions like the golf outing and the Christmas party, which don't exist anymore. And you get to know other doctors, and you develop relationships with referring physicians. So that was how I started, but there's another now time-honored way of building a practice, and that is to buy one. And in my first year of practice, I was starting to get a few referrals, and the chief of surgery, who was he had just retired. His name was Joseph Silverstein, and he was still coming to the department meetings and stuff, and I used to see him all the time in the physician's lounge, and I asked him a question. You know, Dr. Silverstein, what did you do with your practice? Did you sell it to anybody? And he says, nah, it's not worth anything. And I go, well, it probably is. Why don't you let me make you an offer and I'll buy your practice? He goes, no, it's been closed for, almost a year now. It's not worth anything. I said, well, can I make you an offer? He goes, sure. I said, I'll give you $10,000 for all your records. He goes, nah, that's too much. Then I said, okay, all right, I'll give you 5. He goes, sold. And what that did for me was actually he decided he wanted to support me and promote me. And literally within the next 6 months, I became the most busy surgeon in that particular hospital, and that was the start of my practice. The opportunities to build those kind of practices now are just about absent. Everybody belongs to groups, almost. There's very few of us, like myself, that are independent physicians that are still in practice. It's very hard for an independent person these days to start. But it still can be done, so I don't want to discourage you from it. And probably the way to think about it is to do what a number of the physicians here that have spoke, start from the very beginning, taking care of uninsured patients, stay away from the insurance contracts, and build the practice that you want from the very beginning, if you have an opportunity to do that. And I really applaud the people that have talked to us today that have told us that that's what they've done. The second time that I built my practice was after leaving Chicago and coming to Las Vegas, and I built it basically the same way again, that is with doing physician referrals and also by taking the ER call. All right, I'm going to move things along a little bit faster. I've got the time clock up there. But then when I saw that the insurance was going, the world was going so poorly, I realized that I had to change my practice. And this is when I had talked to my plastic surgeon friend and found out, how to make a package that worked. And at the same time, what I did was I started marketing. And I'll tell you that I experimented with all the traditional marketing, billboards, TV ads, radio, and found that I spent way more money on marketing on those mediums than I got back in revenue. And this was for my particular practice. It might be different for different specialties and different communities. And I built a website at the same time. And I'll tell you now that in the past 5 years since I built this website, when I initially started it, all of the traffic that I had to the website was traffic that I paid for. That is cost per click type campaigns. And the primary example of this is something called Google AdWords. And this is an advertising campaign where you pay Google to show your ads when patients do searches on the Google network. Now, over the past 5 years after starting with Google, my website has gained all its own popularity, and currently I only pay for about 25% of the traffic. I still use the Google AdWords pay-per-click campaign, but 75% of my traffic is now what we call organic searches. And on my website, I get about 1,000 visitors a day. I'm past the 1.5 million visitor mark now since the entire time it's been up. I get about 30 to 40 patient contact forms from patients every single day. Of those patient contacts, I do telephone consults on about 10 patients per day, and then I get about 2 cases per day in scheduling from all this internet activity and patient contacts forms and doing the free telephone consults that I do with patients. And the result of this is now that when I was completely dependent on insurance, I was working 80 plus hours a week. Currently I work maybe 50 hours a week. I don't work nights at all anymore. I don't work weekends anymore. My income has doubled several times compared to what it's been recently. And I enjoy my practice actually better than I ever have in my entire practice. Now, one of the other things that I do now also that's kind of a sign of how good I think my practice has become is that I've recently created a nonprofit organization called Helping Hand Surgical Care that provides charity surgery for patients. So I like several of the surgeons, physicians here that have spoken, I enjoy doing charity care. And I enjoy it because it's a choice that I make. And through the charity organization that I created, what we do is we get donations from the community. We use those donations to pay facility fee and to pay for anesthesia, and I do charity surgery. And honestly, I'm enjoying my practice more than I ever have in my entire career. Thank you.